Hi.
Hi. I'm going to just start because we're on time, and I just wondering how many of you, just before we start, how many of you know LifeWave patches and how many are newbies? Yeah, I can't see everyone, but so what I think we'll do is hold any questions to the end. So that, and I see Laura's saying she's new. So I think what we'll do is hold any questions to the end. Very simplistically, for those of you that are not familiar with LifeWave, yeah, we've got some new people, which is great. So just very quickly, before we get into it, LifeWave patches are simply just little things that look almost like a Band-Aid, but they work with your body. So they're not adding anything new to their body. They're actually generating change within your body based on the acupuncture point that you place them on. So it's sort of a bit of a cross between acupuncture and red light therapy, and we teach you which acupuncture points get results, and we also teach you how to do it. So this is what I'm talking about, these little patches, and I'm not going to go into much more detail. We can hold questions to the end. If you have questions, just pop them in the chat and I will read them out to Lisa Ann. So without further ado, this is my friend and colleague, Lisa Ann. And rather than me read off some boring bio, I thought I'd just ask you, Lisa, we've all got our story about what brings us to health work. What would you like to share with us about your story as to what brought you to LifeWave patches and to this work?
Okay, so first of all, I am a mom of three. I have a 24, 22, and my youngest will be 15 this week. And my 24-year-old has suffered with ADD his whole life. My 22-year-old, he has moderate to severe autism with a severe language delay. And my 15-year-old was a Speedy Gonzalez. He was born early, and that kind of caused some movement motor kind of issues, just some cognitive issues a little bit, but different. We mitigated a lot because of the age difference between my kids. And, but then I've been in education since the mid 90s, so almost 30 years. Actually, at first I was a bilingual Spanish, but I became a math specialist and worked at the university, published some books. And my last stint in the schools was 7 years in Japan. I was living on a military base, and I was a resource teacher, and I was pulling kids out. And I found as like, okay, I need to really study what's going on with the brain, because these kids they don't really have just like a math problem. They have they're seeing the reading teacher and the OT and the speech therapist and whatever. So I go, something else is going on. And because of that and my own, child, I spent a long time trying to learn everything I can. And I kind of snuck all the good stuff in school, but I really had to divorce myself from the school system because I can't really help kids in the schools the way they need it. And so I became a neurodevelopment specialist. Between educational modalities, movement modalities, I became a functional diagnostic nutrition practitioner because, and that's how I know Alison, because I knew that if I was going to recommend not to eat gluten or something, I should have some kind of paper behind me backing me up. And and then I found Dr. Klinghardt, and I got certified in the autonomic response testing. And so and I just, every time I learn a modality, it's all about focusing on the brain, focusing on, but obviously our brain and our body are not disconnected, they're connected. But everything I do is just trying to figure out and I focus on kids most because, my business is called Whole Child Learning and Wellness. I just wanted to learn every aspect of what's going to help the kid. because I know what their struggles look like in the classroom. And so they're the ones who I kind of focus on. I know how things translate into the classroom. So that's, and then about a year and a half ago, Laura, who's on here right now, my friend, she shared with me the patches. In fact, my husband went out of town and she actually flew out to visit me. And so we were testing, we're like, wow, these tests are really strong. And what I loved about them is because there were, I think one of the first webinars I watched was on how we can use them for the brain. And I'm like, oh, that's perfect. And plus I was like, finally, I have a product where I can help anybody with everything, even though we're not supposed to help everybody with everything. But I just felt like I have a tool, such a universal tool to be able to help so many people with so many different things. But I loved the things that we can do for, the anxiety and the focus and all the brain stuff. So that's how I kind of came into patching.
Yeah, and just for those listening, what Lisa Ann doesn't know about learning development and the brain probably isn't worth knowing. Although, I mean, as practitioners, we're always learning. And but one thing I just wanted to reinforce to people is for those that know me, you'll know that I use a kinesiology sort of biofeedback-based system developed by Dr. Klinghardt because I'm working with highly sensitive patients. And we actively test the patches. So, for example, the glutathione patch tests better than liposomal glutathione, and we can actually see it protecting the whole body, not just the liver. So when we're recommending products such as LifeWave, I'm doing it because I know it is the best option for many of my clients. So without further ado, I'm going to hand over the hosting to, I'm just going to make you the host, Lisa, and you can, Lisa Ann, and you can get moving.
Okay, so.
Okay, you're the host now.
All right, so let me try that again. Okay, good. Here we go. All right, so you can see my screen, I assume now?
Yes, you're good to go.
Awesome. All right, now I got to just move you people over so I can read. All right. Okay, oh, there we go. Okay, so today we are going to talk about how to use Acupoints and LifeWave patches to support mental, cognitive brain health. And we, there we go. So the objectives today is we're going to familiarize ourselves with some common patches that are used for brain stuff, some common points that are used for brain stuff, some basic brain protocols, and some protocols for a few common, maybe a little bit more specific conditions. So we're going to kind of group everything that way. First, we're going to talk about patching basics. So Alison already introduced to us what the patch is, so I don't really have to go into that. But the reason I love it is because it blends my three favorite modalities. After actually studying with Dr. Klinghardt, you can't leave without loving laser, light therapy, loving frequency medicine, and Acupoints. And so that's what this patch does. It blends all three. In Chinese medicine, and I'm not an expert at Chinese medicine, but in Chinese medicine, basically issues in the body are caused by either blocked energy, excess energy, or a lack of energy. And then if you have excess energy in one meridian, which is like a river of energy, they're all interconnected. If one has too much, then somewhere else there's probably too little. And so it's all about balancing. And these patches help things flow smoothly so the body has enough energy to do what it's supposed to do. And so so some of you said that you are new. Some of you I know have a lot of experience with patches. Basically, you can be as simple or as complicated as you want or are capable of. So I kind of tend to geek out on things like Acupoints and functional medicine or whatever, and try to blend things and all kinds of things. However, all you need to start simple is you can just literally have one patch. I would say if you're going to really want to affect the head, just on the back, I don't have one here, so I'll put one on for you on this side. Just take the backing off of the patch, and literally at the base of the neck, there's a bump and you can stick it there. And if that's as complicated as you want to make it, that's as complicated as you need to be. However, there are other strategies, so we can combine patches in different locations on different points, maybe just to make things a little bit more effective. And last year it was really funny at our at the conference last year, there was a keynote speaker, and she was not part of the company, but she said that she heard a lot of people in the hallway talk about which patch to use and where to put it. And they were all kind of like nitpicking. And she says, you know what, just stick it and go. Okay. So just know that it'll still work. But we're going to look at a little bit more specifics. So when talking about the brain, basically, all the patches can have a good effect on the brain. The X39 patch, that's the patch that elevates our stem cell production. So whenever you have stem cells, it can go around the entire body and become any cell that it needs to be. So that would be good for brain repair. The Eon patch is great. It's what it mainly does is it works on the inflammation and regulating the parasympathetic and the sympathetic nervous system, that fight or flight or rest and digest. So that's especially good for things like anxiety. But the Eon and X39 together, if somebody has a lot of issues, inflammation can eat stem cells. So if you put the Eon, if you use them together, not in different places or whatever, but if you use them together, the Eon can help cut that inflammation so that X39 can work even better. The Alavita patch tends to, what they found, that's just kind of more of a skin thing. However, they found in their research, I think it was by accident, but they found out that it seems to have a good effect on the frontal lobe. So the Alavita patches can be good for that. Carnosine is works on organs and tissue, and especially in the organs. So the carnosine can be good for the brain repair. My autistic son, a lot of times, because I muscle test all my patches, and there was a long time where he was testing every day for carnosine on his left temporal lobe. So I was put somewhere on the brain. I was putting it on his brain. Glutathione, if you don't know, it's your liver makes it, and it's your body's, a big detoxifier of your body. So the glutathione patch will upregulate glutathione and sustain it, because oral glutathione has a half-life of 7.5 minutes. But the glutathione is great because when we're talking about autism and ADHD or whatever, it's all a toxicity issue. So you want to be helping to detoxify. And a lot of times those toxins are in the brain. Then we have energy enhancers and ice waves. The energy enhancers we'll talk about on the brain, but it can kind of help move energy through the brain. Ice waves, if there's too much energy in the brain, like you're, racing your mind, it can calm it down. Silent night can help with sleep, melatonin, or if someone with ADHD can calm it down. Well, and we're going to kind of talk about a little, throughout this webinar, a little bit more specific. And Nirvana. Nirvana is temporarily discontinued, but it should come out again, I don't know, within a few months, who knows when. But Nirvana patch is really good for the calming as well, good for depression. But it's also good for the kind of the frontal lobe area. So this is just meant to show you that all the patches do have pretty much some benefit, or these are most of the patches, not all of them. Okay.
And so Lisa Ann, as she was sort of saying, if it can sort of be a bit overwhelming with all the patches initially, but just to repeat what you said before, which is at least put the X39 on. If you're going to start with one patch, put the X39 on and work out how the patches work, and then add in other patches can be added in. Does that sound right to you?
Yeah. I would definitely, if you just had to start somewhere, start with one patch And most of the time when I muscle test, it'll be the X39 and start that and just put it on the back of your neck and then kind of go from there.
And simplistically, what X39 is doing and why I often start there is it's repairing things. It's assisting the body to repair things. So when, like even if we have gut issues, it's going to help repair the gut. So that's often why, if you want to keep it simple and you just want to start somewhere, that's often just a good place to start, to pop that on and then, move through these more advanced sort of options. Yeah, cool.
Okay, so we're going to look at the 5 most common points that are used with mental health conditions. And I already showed you, the GV14, the governing vessel goes from right here all the way down to your tailbone. And on that bump on the neck is number 14. That is probably a very, very common point. But besides that one, basically what I did is, I'm familiar with some of the protocols that maybe people made with LifeWave, but I literally, when I wanted to know, like for autism, trying to figure out, like maybe for my son, getting real, like I say, geeking out and getting a little technical, I just Googled. So this is all you have to do. I Googled what are common acupoints that are used. I mean, just in general, from acupuncture perspective, what are common acupoints that are used for autism or ADHD or whatever? So you can, and this is kind of what I came up through all my studies. These are kind of the 5 most typical points. The first one is the Heart 7. Basically, that is under your pinky, like right where you see it, just like right there on your wrist. That is has an effect of calming the mind, relieving anxiety, worry, promoting sleep, lowering inflammation, and stimulating the cerebellum. So I actually found this point through some ADHD webinars of something completely not LifeWave related, but I had that point always noted because the cerebellum is part of the brain, and but it's an anxiety and a worry and sleep and all that kind of stuff. So that's there. But the next point, and actually this is in LifeWave, this is the point I probably use the most besides the one on the back of my neck. It's right here. But this is the pericardium 6. And as you can see in the picture, if you just put like 3 fingers at your wrist, that 3rd finger is right there in the center, is a pericardium 6. This one, if anybody has ever gone like on a boat and you buy these sea bands, they have like a little ball on it and you can press it. It's really good for seasickness. So it's sometimes known as the seasickness point because of its effectiveness for nausea. It's helpful with vomiting, hiccups, and the fullness of the abdomen. It can also assist with insomnia, poor memory, apprehension, fear, and depression. And it's this point has been found to activate the parasympathetic system and increase vagal activity. So the vagus nerve is responsible basically for our parasympathetic rest and digest. It's a cranial nerve, number 10, and it goes all the way down to a bunch of your organs. And so I think this is why this point, for me, EON tests, sometimes even the X39, I'll put that there too, but either the EON or the X39 will test, and that tests a lot for me because we're trying to move away from that fight or flight, and it's kind of trying to rest that parasympathetic. But the EON patch, the frequencies in that patch is designed to also balance that sympathetic and parasympathetic. So I think that's why they test so well together. Anyway, so this is probably one of the most frequent spots that I use. So if there's anxiety, I would use that point first, probably. Oh, and then it reduces the activity of the sympathetic neurons. This effect, it's primarily achieved by adjusting the brain to secrete the inhibitory neurotransmitters such as GABA, 5-HT, and it regulates cardiac function by the central nervous system. So basically, I guess it's kind of telling your body or your brain to release GABA, and that's our like calming neurotransmitter. We have the glutamate, which is excitatory and neurotoxic, but it kind of converts into GABA. And sometimes, like autistic kids, they're stuck in that glutamate. They have too much kind of glutamate going, and so we need to. We want to be able to boost our brain's production of GABA. And okay, point number 3, the liver 3. This is another point that I use a lot, and right there. So if you can see, it's because I'm using my cursor on my. Anyway, I don't know if you can see my cursor, but there it goes. So just in the webbing between the 2 toes, you just kind of go up to where it's a little bit kind of soft. And this one basically is said to calms the mind, reduce stress, irritability, relieve headache, improve digestion. Studies have also showed that this point activates areas of the visual cortex, treating vision-related diseases. These are not studies that are LifeWave studies. They're just Acupoint studies, acupuncture studies. There was a study done, and I'm not even going to read all the points, but it's like the brain, there's a picture of the brain, and it's called the Brodmann's area. So what they do is they kind of they number the parts of the brain. So when you say, oh, number 19, people who know what number 19, it's a certain section of the brain. So this point has said to affect like BA 19, 20, 21, 32, 38, 9, 30, 21, 24. So this point can really affect a lot of different areas of the brain. And so that was just a study with pure acupuncture. It affects the anterior cingulate gyrus, which is involved in complicated motor functions and pain reactions of the body. It also seems to have an analgesic effect, so it's like a pain-reducing effect. It helps with vertigo and lower limb paralysis. So these are things I didn't really know about it, but they found in their studies. And because it's on the liver, one of the patches, the glutathione patch, oftentimes will test for that point because it's like detoxifying. The silent night, a lot of times, that tends to be a point that some people have good effect using the silent night patches for sleeping, probably because of the liver in the middle of the night maybe activate. Just my guess, but I know that the liver during the night, I think it activates and can wake people up maybe, and so maybe that's why, I don't know. Point number 4 is stomach 36. This one calms the mind, strengthens the stomach, regulates digestion, supports energy. It's known as the point of endurance or the 3 extra mile point. So it's good for chronic fatigue. It's good if you want to run a marathon. So it's just a point that's known to kind of get that extra. I know it's like when 20 years ago or 25 years ago when I was running marathons, maybe I would like to have known about that point. But oh, by the way, to find that point is, so you put your hand under your knee, and it's about, so you have those 4, it's at that 4th point, but it's right on the outside of the femur bone. So, and then you just put your fingers under there where that pinky is. It's like right on the outside of the femur bone. That's the point. And the good thing about, by the way, when you're dealing with acupuncture, and if you're getting needled, the point has to be very exact. But when you're dealing with things like the patches, well, first of all, there's such a big surface area, you don't have to be quite so exact. And anytime you're dealing more kind of with energetic work, you can just be within a ballpark of that point and it'll still affect it. So that might be good to know for some of you. And the 5th point is the 3rd eye. It's actually technically the governing 24 and a half point, because the 24 is at your hairline and 25 is at your nose tip, and that's the 24 and a half. It's the 3rd eye. I think it's called also maybe like the yin 10 point or something. This one is good for like nosebleeds, high blood pressure, headache, anything kind of eye related, nose related, even pregnancy epilepsy, which I did not know, and trigeminal neuralgia, that's because those nerves are so close. It's also known as the Prozac point because it does induce deep relaxation. So a lot of people, when they're just using acupressure at that point or acupuncture, it's supposed to be a point of deep relaxation. So somebody just told me, I think it was one of my friends on this caller, somebody just told me today that they used the silent night on their third eye for sleeping. Okay, so that's 10. So for the silent night, that point and the liver point are kind of two of my favorite ones. Okay, we're going to talk a little bit about cognitive issues, but before I do, I just want to kind of give you a little orientation. The brain, we in brain gym and kinesiology and different in movement modalities, the brain has what we call 3 dimensions. We have the back to the front. There's a connections between the back and the front. There's the connection which is connected or related to focus. So when the back of your brain is not well connected to the front of the brain, we have all the focus issues, the executive function issues, and those types, ADHD. When the good strong connection, like up and down, is related more to our mood. Our limbic system is our emotional center of the brain. It's the very center. So that's kind of the mood, and the amygdala and all of that is in the center. The centering, whether you're grounded, and the connection between the brain from side to side, from one hemisphere to the other, that's has a lot to do with learning, academics. We need both sides of the brain to be on, and then other kinds of behavior as well, not just for the centering, but other kinds. So when we say we want to integrate the brain, we want all 3 of these dimensions, to be balanced. So we want balance from the front and the back, the side to the side, and the up and the down. So the common brain protocols, just some basic protocols. So we have a brain balancing protocol. And that brain balancing protocol, so there's one that, like we say, if you just had to have one patch, in this case is the Eon patch. I do find that when I'm testing people, either the X39 or the Eon, they're the ones that come up the most. And because a lot of it's just inflammation, and it's like, let's get this inflammation down. So if you're taking the Eon patch, I'm sure you could do this exact same thing with an X39 patch as well. But these points on the head, and so I didn't really talk about them in the points, but they're pictured there. These points on the head are, this one I did. Up at the top, the one at the very top is a good master regulator point. There's, we have on top of the ear, behind the ear, in the back. So what we can do with an Eon patch is you could take one patch and every 2 hours rotate it between these points. Or if you have something a little bit more going on, you could put points on all of the patches on all of these points for a couple hours and just really try to cut the inflammation. But otherwise, just take one patch and you can just move it around to different points throughout the day. And that seems to be good. Now, just to note, without getting too technical, if you notice, these patches, generally speaking, are midline. The white patches, they're midline or right-sided. So this patch, you don't necessarily put on the left side. There's a different patch. You could do that. But anyway, that covers, I don't want to get too technical, and that covers most of the brain. If you want to be a little more clever, you can, well, first of all, when I've worked with kids, it's like, well, putting patches in their hair and then having to go out all day isn't like the most ideal thing. And because girls are afraid it's going to hurt when they pull it out of their hair, even though these patches actually don't hurt when you take it out of your hair. But you can put these patches in a hat. They can go on your clothes. They don't have to go directly on your skin, because your body heat is activating them, but you're not absorbing anything. There's no chemicals. There's nothing in the patch. They're activated within 6 inches of your body. So when we're talking about brain stuff, it's very convenient. I have my hat back here.
Got mine.
Yep. So here's, so I just have patches in this hat, and actually I have 2 hats. I have a patch that has energy patches in them, and I have a hat that has LifeWave patches in them, because I have so my autistic son, Joshua, he needs more the LifeWave to calm his brain. And the other one, I'm kind of just trying to stimulate his brain. So I just have 2 hats made. One, and I actually had on this one, it even says right here, ice. So I remember which one it is. Because once you take those backings off, you can't distinguish the patches. So you have to somehow mark it. So anyway, this one's my LifeWave patch. So you can put patches in a hat. Now, in this particular brain repair protocol, so these are the last one is the brain balancing. This is brain repair, but I think if this one was probably just a second generation of the other one. This one has at the top of the head would have the eon and the glutathione stacked on top, literally stuck on top of each other. And then on the right and on the front is the white energy enhancer patch. The energy enhancer patch, by the way, is a paired patch. For those of you who don't know, it means that there's 2 patches, a positive and a negative. The white is positive and the tan is negative. That's all I'll say about that. So we have the white, and then the tan would be on the left, and then in the back, and then we have this other 2, and that gets a lot of energy flowing. This can be very stimulating. You might only want to wear it for 1 or 2 hours, like if you were going to. So I have my one son wear this while he's doing a program, like a reading enhancement program. So I'm having him wear this hat while he's doing that to see. But I've seen webinars. If you are part of our group and you're in our group and you search brain balancing webinar, in Joyce's webinar, she shows a video of a guy who had a stroke, and he used these to he saw some really good symptom relief. And so you have to kind of go in that group, if you're in our group, and go search for like videos on different brain stuff, stroke or whatever. So, and again, we're not doing anything about diagnosing. We're not making claims. These patches just help the body balance the energy and do what it's supposed to do on its own, just to help.
So just a couple of points I want to reinforce is, firstly, as Lisa Ann has said, you can pop these patches on clothes. So if people are very sensitive, you can actually place the acupuncture, the patches on clothes or things like brain caps. And one of the reasons that's really good is that we know that the patches last for about 2 days of wear. So by putting them on the brain cap, we can literally wear the cap for, say, an hour a day for up to 24 hours, or we can wear it for 8 hours a day and take it off when it's stimulating too much. And just as an aside, the way I came into LifeWave patches was actually with this cap, and I put the cap on, and there was so much crud draining down from my brain. There was no way I could say that the patches weren't working. So in that instance, I could only actually wear the cap for about 10 minutes. Now I can wear it for as long as I want. And I think that's the other good thing about these patches. We're not actually putting something into our body. The minute our body has had enough, we can just pull them off and everything stops. So, beyond the cap, we can put them on all sorts of things, but because we're talking about the brain, the cap is perfect.
Yeah. And also when you take it off, don't stick it right next to your window, but, kind of keep it in a kind of dark place. But yeah, you have, like she said, about 24 hours of life in those patches. So if you're using them 1 or 2 hours a day, just kind of keep tabs of how long you use them. I mean, fortunately, if you can muscle test, I always muscle test to see if my patches are active or not. So for those of you on here who do that, I just ask, is this patch still active? And then I'll know. And some days, you can get a little bit more or less use out of it. Okay, so some of the common conditions, we'll start with anxiety. Anxiety, you might want to use an Eon patch on that pericardium 6 or on that heart 7 or on the back of the neck. Those would be some good points. The Nirvana, I found, if you still haven't, I have, at the end when they were telling us that they were going to discontinue for a while the Nirvana, I bought a whole bunch of packets. So I have way more than I ever need, but just in case. But when I patch people for Nirvana, usually the chest just on the sternum is it's kind of just right here. That tends to be the spot that works really well with the Nirvana. People will tell me that they either get a euphoric feeling, that they will see vivid colors. My adult son, he says that he connects better with people when he wears the Nirvana at work. So he has better, he can connect better. So anyway, Silent Night is great for anxiety too, because it can calm. And then ice waves on your kidney one. Your kidney ones, these are your feet. Your kidney one point is right here. And so you can put that because it's calming, or you can put them on the pericardium. Ice wave, like the energy, is a dual patch. So you would put the white one on your right hand, the tan one on your left hand, and that would, or if it's on your feet, you put one on each foot, and then that really helps. So that's for anxiety. For ADD or ADHD, the point behind the ear that's on the mastoid bone, it is, I guess it's the SJ17, or whatever. That's the point behind the ear. You can also use pericardium 6 or governing 20, which is right here. And, basically you could use Eon, or, you could use kind of any of the patches that you feel that you would need for that. The Eon on the neck, Alavita on the third eye at night, or the Silent Nights. You can, when you get patches, you get these little booklets that come with it. And the very last page will give you some patching suggestions, because different patches, when they did their research, they use different points. And so, for example, Silent Nights has these different patches, patching suggestions. So if you had Silent Nights and you put it in one spot and you say, well, my sleep didn't really change, well, then maybe choose a different one until you find one that seems to work better for you. So ADHD is a lot to do with calming the mind. However, ADD is a little bit the opposite. And so it's more like that focus. So the ADD, anything to do with focus, I would do stuff up here, and then at the back of the neck. Actually, come to think about it, I would probably use the back of the neck and up here at the same time, because we are trying to get that dimension, that focus from the back to the front working. What's funny is when I was substitute teaching, last year, I had the patches and I had a 5th grade class, and I asked at the end of the day, I was like, oh, can I have a volunteer? So I wanted, in Brain Gym, we can test those dimensions using movements and muscle testing with their arms. And so I had them do those movements, and then I took a patch and I just taped it to their hair, in different spots, because I wanted to see if it shifted. And it did shift. I took an Eon patch, and I don't remember which one it was, but I remember the kids were like, whoa, so they could see a difference in the balancing of the brain. Okay, now we get to autism. So autism, obviously, it's super complex, right? Patches alone aren't going to be the only thing you do with autism. But autism is basically everything that we're talking about. It's all a toxicity issue. Everything in our bodies, it's all based on toxins. So we do know that we need to kind of address toxicity, and might want to start with glutathione and carnosine. That's kind of, I think David Schmidt, who is the inventor, he kind of recommend, using glutathione. So you could use glutathione here, or you can use it on the back of the neck. You could use the carnosine under the belly button or on the back, because autism, the kids have a lot of gut issues, and so the carnosine is going to kind of help with that area. I would also personally add, I have another slide too, but I would also add Eon and X39. And I was saying, my son, when I was patching for a while, carnosine and glutathione was what I was always patching him for, but it was always like around his head. And even though they're right-sided patches, his issue because of his language is actually in the left hemisphere. So I was patching his left hemisphere with the glutathione and the carnosine, because I think that's where some of the metals might be stuck. And of course, you need to try the gut. You can try the glutathione on liver 3 on the foot and on the crown of the head. You can try Eon on the third eye. Yeah, actually, let me see if that's what this one shows more. So, okay, here we go. So we have you can do glutathione on the top of the head, or maybe on the stomach, on the foot. You could do the Eon on the third eye for the calming and the inflammation. Carnosine could be on the chest. So energy white on the PC, or on the heart 7, and tan. Actually, I'm on the opposite arms. And the tan would be on the PC6, Eon on the back. These are just protocols I found. I haven't used. I muscle test every patch in every location, but these are things that I kind of gathered and found. So, and also when you're using patches, you don't have to use them all at once. So just do between 2 or 4 every day, and you can alternate them through the week. So you could do 2 different patches in 2 locations and just switch it up throughout the week.
And for those of you who are new to LifeWave, we teach you how to self-test as well. It's actually a very simple process. So I will include that link as to how to sort of self-test. So initially, the protocols are really helpful, but as Lisa Ann's finding, just by simple self-tests, you soon discover what your body really needs, and almost in turn, almost a sixth sense as well. So although Lisa Ann is muscle testing, we will also show you a simple test that you can do for yourself. And I'll include that video with this video.
Yeah, it's a great entry point to people who have no experience with muscle testing. That video is technique, and that video, it's a great entry point. It's, in fact, when I used to do it, when I was learning a long time ago, when I was learning all the different techniques, and I did it with some students, you would do it, and they just they're kids, 5th graders and stuff. They're just floored. They're whoa, they just think it's magic and everything. So, kids really like to do it. And in fact, so it's a sway test. And my youngest son, he was younger, and when he was sway test, he would actually he was doing the opposite. So his yes was back and his no was front. And I just took it as such. And I just told him, okay, well, all your yeses are backward. And I went to a training for something else for Brain Gym. And I told I was in Japan, and I was telling one of my friends that was in the group, and she's like, oh no, he's switched. And so she said, just do tap, she'd show me different tapping points or whatever. And then, and he switched. And so I started doing that, and after a couple of days, and he was testing correctly, but I didn't even know that was a thing. So, but yeah, we can be neurologically switched, and we can be because some people will tell me, they go, this might sound really weird, but I respond to medication or supplements not the way I'm supposed to. They respond opposite, and I go, oh, you're probably switched. So our nervous system can be kind of we can have reverse polarity, but that's there. And there's a video in our group for that too, if that's the case. But, and so our group, LW Team Learning, you have to be invited. So if you're one of Alison's people, she would invite you. If you're one of my people, I would invite you. And on that group, I don't know what number they're up to. Are they at, they're probably way past 55,000 now. I don't know but 55,000 people, but you just literally in the little magnifying glass search thing, you just search any symptom that you want, and you just see all the different things that people say that they've done to help themselves, like which patches, where. You might see diagrams of protocols, you might just see video testimonials, and but it's a huge resource for kind of figuring out.
There's sort of over 50 protocols, but I think what Lisa Ann's sharing today is much more refined. But you can search for any symptom or condition and usually find a protocol that will provide relief. Yeah, it's a great resource.
Yeah, and some people, some people like it because they, like me, they like to geek out and they're like, wow. And some people are like, well, it's like too much. So if you're the person that would be too much information, just start with your X39, put it on the back of your neck, and you're good to go, right? And so, or if it's, or at the, under your belly button. Sometimes having it too close to your head is too stimulating. And so you need it like lower in your body, like in the bottom of your belly button. But anyway, so wow, this went faster than I thought. So anyway,
time for questions.
Yeah, so we'll have plenty of time for questions. You can email me at hello@lisaanndegarcia.com. I am on Facebook with my full name. I am on Instagram, but I'm much better at Facebook, but I am on Instagram, and I have a YouTube channel. Whole Child Learning and Wellness is my YouTube channel. And I have a whole playlist on supporting ADHD and other cognitive issues, and have tips and tricks. And in fact, Joshua, my autistic son, when he was 5th grade, I remember, because I was still a math specialist, I was teaching at the university, and I was like, how am I going to teach this kid how to do long division without the language? And so, but everything, my whole career has been about developmental approaches. Kids learn things developmentally. So I did a whole action research project for myself. I wrote a paper, it never got published, but I videotaped the whole thing, and how I started and how I got him to understand and do long division non-verbally. And so basically I have a whole playlist on that. It used to be used to be on an iWeb site they don't even exist anymore. So I had it all mapped out and everything, but I just have the videos there. And so if anybody's curious, I have that on there too. But yeah, that's how you can contact me. So yeah, totally open for questions.
So does anyone have any questions? Hopefully we haven't totally confused the newbies. If you are new and if you're interested, this is working on really what we call the energy body of correcting, if you like, the wiring signals within the body. Best patch for inflammation. We've got a question. Ruth would like to know what the best patch for inflammation is.
Eon. That's the Eon patch. That's what it focuses on, is inflammation. So when you wear the X39 does help with inflammation. So if you busted your knee playing soccer and it's swollen and all you have is an X39, it's totally going to help. If all you have is ice waves, it's still going to help. They all have properties of inflammation, but the Eon patch is focused on inflammation. So
I've actually done that brain one where I've put all the Eon patches on a cap, or the ones that would fit, and I think there's one that wouldn't, and dramatically reduce the inflammation in my brain. So we've got another question, which Chris is saying, how do you attach patches to hairy areas?
You just attach it to the hairy areas. That my son has a little bit of hair under his belly button. So sometimes he doesn't really want me to put it there. He like puts his hand over, like, cause he has a little bit of hair right there. But, so I just kind of, just put it somewhere else, but you can put it on your hair. Like if you're going to go to sleep, you can put it on your hair. I mean, you don't want to walk around in broad daylight, with patches all over your head, but it does, because it's just activated clothes. So you could put it inside your clothes or on your clothes if that's really a problem, if that, on that part of your body or wherever it is.
So I find they do stick reasonably well. I actually find if I sweat a lot, like because I'm in the subtropics, that's more likely to affect the ability for me to use it for a couple of days. I mean, you can definitely use it for that period, but I find that in hairy areas they do stick. The other option is just put them on clothes. So, for example, if you're trying to put it under your belly button, you could just put it on the backside of whatever clothes you're wearing, for example. This is another one. What would you recommend for OCD, Lisa Ann?
So I would probably recommend the one with the Eon, the brain balancing. Just putting the anti-inflammatory patches on the brain, or maybe if you're doing the brain repair, maybe the one with the ice waves, because your OCD, your brain is like this, right? So but yeah, anything that's kind of calming, even the silent nights, anything that's kind of going to calm down the brain, the nirvana.
So the next question is, how much do the patches cost, and do you have to do a consultation before getting the patches? And let me just say, in the ebook that we're going to send out, which Lisa Ann has done, which includes these protocols, we'll include a link so you can work out how much the patches cost. The cost of the patches depends on how you buy them and how many you buy them. At their cheapest, they're in that $40 to $50 range, and they include 30 patches. And I actually use those patches for a couple of months, basically. And what I do is, if people sign up under me, and I'm sure Lisa Ann would be the same, I actually give them a free consultation just to get them started. And then within the groups, you can ask questions. You can tag me and I'll answer questions. So that sort of tends to be the way I approach things. My aim is to get you sufficient in working out what your body needs. What I find the patches do for a lot of my clients is you actually almost develop a deep understanding of what support your body needs, because you put a patch on a particular point, it doesn't work. That's not right. You put it on another spot and whoa, hang on. So for example, for me, and I don't have that mental health presentation. I do have an acquired brain injury where I wear the cap. But the thing that got me over mold illness was putting an X49 and an X39 on. And I went, whoa, I have more energy than I've ever had. So it's almost, if there's no response, it's not what your body needs. But if you put it on specific points, you will know it's working.
Right, and actually that reminds me that you need to be drinking water.
Yeah.
And make sure that you're mineralized too, because you want to have good minerals and you want to be drinking water. Especially if you're not responding to patches, then the first thing you need to look is, am I hydrated? And do I have minerals? So those are the two kind of basic points. And and I put the link to the ebook in the chat. Mm-hmm. And And yes, I also, like, if anybody who is purchasing patches, they just talk to me, and I spend a long time, and I will test. I'll even test which patches I think will be best for you, where, depending on what you have. So I'll do some testing to see like which patches and where. So
okay, just another couple of questions, because I've only got 5 minutes because I've got a group I'll need to leave, but I can leave you in with everyone. So the next thing is, any ideas if we're dealing with dorsal vagal activity and the tendency towards shutdown and collapse?
So that is okay. So that has a term in different fields. So in functional health, they call it, well, from what I am understanding of the question, they would be calling it like oh my gosh, Alison, this is your thing, the cell danger response. So that's like the cell danger response, because in my other world, in all the kinesiology, in all the movement stuff, we call that the fear paralysis reflex. And when I was studying this side, I was like, wait a minute, I think we're talking about the same thing. Because so one of the things too is, and then in minerals, they'll say that there's a calcium, it's a calcium shell. I think there's too much calcium built up around the shell. The baby, like, it starts in utero, and the baby is just like, it's a cellular response preventing toxins from getting in, and we can get stuck in that response. So I would say, so anything on PC6, that's going to help that parasympathetic to kick on. So anything to activate the vagus nerve. The vagus nerve is closest to your skin, right behind the ear, and that point that's like closest to the surface of your body is right there. So I know, like with Dr. Klinghardt, we would laser there, acupressure, but you could patch there too. But it's kind of a big topic, but I would say in the realm of patching, anything that's Eon, Nirvana, probably, and the PC6 would be really good places to start. The Nirvana could be on the chest or on that point.
And just to sort of expand on that, in my world, I classify people into basically gut issues, leaky gut, switching, which is this autoimmunity where the wiring's confused, and then something called blocked regulation, which is akin to the cell danger response. It's akin to what we're talking about here, where the wiring can't easily switch. So we've got leaky gut, we've got chaotic switching, and then we've got really a failure to switch, I guess, would be the way, so our electrical wiring just needs stimulating. I'm not sure whether that's a dumbed down response, but,
if
just
this person is talking about a child, not to really go off a non-LifeWave thing, but just a very basic thing is we need to be giving a lot of deep pressure and a lot of deep sensory input. So that is very helpful for that too. So when, as you're patching or whatever, but do a lot of deep, deep, deep pressure, and that helps also with the nervous system.
So if nobody has any other questions, and I need to love everyone and leave them, I just really want to thank you, Lisa Ann. I personally have learned a lot, and I'm sure everybody else has, even for those new to LifeWave patches. I think I think your knowledge of the brain and everything else is fantastic, and I'm really grateful for you sharing this information. I've learned a lot, and I'm sure everybody else has as well.
Well, thank you very, very much. This was a total honor and a treat. So yes, thank you very much.
So I will include information about where to find Lisa Ann in the email, and both her and I are committed to helping people learn this modality. It's simple, it's do at home, it's for the cost of like one acupuncture session, you can do it for yourself for a couple of months. So I'm sure this won't be the last webinar we do on this, but I really hope you found at least one thing in this webinar that's been helpful. Thanks, everyone. Okay. Bye.